Next to shoulder region and elbow region, the third important one is the region of the wrist, including the bones and joints of the hand. I'll show you the related bones and joints of the wrist and hand. This is a plain X-ray of the region of the wrist and hand in dorsipalmar view, or also called posterior view. What are the bones and joints are visible in this view? That we will discuss. If you see here, this is one bone, the broad end, this is radius, lower end of the radius, and this bone is the lower end of the ulna. And here the short bones are there. There are 8 short bones called carpal bones, and here 5 short long bones. They are called metacarpal bones, and in the fingers, 5 fingers, there are total 14 phalanges. This is proximal phalanx, this is distal phalanx for the thumb, but for the rest of the fingers, proximal, middle and distal phalanges. Proximal, middle, distals. So for these 4 fingers, there are 3 into 4, 12 plus in the thumb 2 phalanges, total 14 phalanges are there. Let us come to the radius and ulna once again. In the radius, the lower end, this downward projection is called the styloid process of radius. And here, this downward projection from the lower end of the ulna, or rather, this is called the head of the ulna. From this head, this projection is called styloid process of ulna. One point is given here. That point indicates the styloid process of ulna. Of these two styloid process, the radial styloid process about 1 centimeter below the level of ulnar styloid process. And here there are 8 carpal bones. I told you all these carpal bones are short bones and they ossify after birth. And these carpal bones are arranged in 2 rows. One is proximal row and this is distal row. These 4 bones are proximal bones or proximal row, and these 4 are distal row. And you may be asked, what are the bones of the proximal row and what are the bones of the distal row? This is lateral side because this is radius, and this is ulnar medial side. So for lateral to medial, if I go, this bone is the scaphoid, then this is lunate, this is triquetral, and this is pisiform. So these 4 are carpal bones of proximal row. And the carpal bones of distal row, again there are 4. One is trapezium, this one is trapezium. This arrow is given to the trapezium and the superimposed by the trapezoid, this one. And this is capitate and this is hamate. This is hook of the hamate, this one, this is hamate. So trapezium, then trapezoid, then capitate and hamate. These 4 bones are the 4 carpal bones of the distal row. And when these carpal bones ossify, all these carpal bones, they are short bones and they ossify after birth. Of the 8 carpal bones, the capitate bone is ossifies fast, and the last bone to ossify is the pisiform bone. And the capitate bone, it appears about 2 to 3 months after birth, and is the largest of all carpal bones. And the smallest of all carpal bones is the pisiform bone, and it appears last. That means about between 10 to 12 years after birth. So this bone is visible. That means the age of this individual should be more than 12. And if you are asked, what is the chronological order of the appearance of these carpal bones, you will start with the capitate. Capitate 2 to 3 months after birth, then hamate 2 to 3 months, then triquetral, this one, this is third ear, this is lunate, it is fourth ear, this is scaphoid, it is fifth ear, then trapezium, it is sixth ear, then trapezoid, this one, it is seventh ear, and last of all, again pisiform, this is 10 to 12 years, and all are after birth. That means from secondary center of ossification. Then come to the metacarpals. There are 5 metacarpals. So if you are asked to count the metacarpals, you start counting from lateral to medial side, not from medial to lateral. So this is first metacarpal, then second, third, fourth, fifth. And all the metacarpals are examples of miniature long bone or short long bones. All the phalanges also examples of miniature long bone or short long bones, because all these bones, they are having one diaphysis for the shaft and one aphysis either at the base or at the head. But where do you get this epiphysis? At the base or at the apex? All the metacarpal bones here, except the first one, their epiphysis lies at their heads. But in the first metacarpal bones, its epiphysis lies at its base. Similarly, the phalanges also having their epiphysis at their base, like that of the first metacarpal. So, the first metacarpal bone and all the phalanges, they are having epiphysis at their base. Because of this reason, the first metacarpal also called the modified phalanx. Can you see this small bony projection? This one. That is one sesamoid bone. If you are asked, show any sesamoid bone in this film in the hand, the first example will be this pisiform bone. Pisiform bone is an example of sesamoid bone, and this bone, it is developing under the tendon of flexor carpi ulnaris. And if you are asked to show any other sesamoid bone, can you see? Yes, this is one sesamoid bone under the head of the first metacarpal. So, usually all these questions are asked, and if you are asked regarding joints, you can see so many joints are there. If you start here, this is the wrist joint. Wrist joint is formed by the 3 carpal bones. Here, there is scaphoid, lunate and triquetral, these 3 bones, and proximally this lower end of the radius, and here one articular disc is there. So this triangular articular disc and the lower end of the radius, this form the proximal contribution of the wrist joint. The ulna, this head of the ulna, this ulna does not participate to form the wrist joint. It is very important to remember. If you are asked how the wrist joint is formed, the answer will be it is formed only by the radius and by the carpal bones. What are the carpal bones? Triquetral, lunate and scaphoid. And here radius and here articular disc, not the ulna. And it is an example of synovial joint, and of course it is the biaxial ellipsoid joint. And other joints are intercarpal joints, carpometacarpal joints, and here is the first carpometacarpal joints between the trapezium and the base of the first metacarpal, and here metacarpophalangeal joints, all these are metacarpophalangeal joints, and here are the interphalangeal joints. Where there are 3 phalanges, the joints will be proximal interphalangeal and distal interphalangeal. But in case of thumb, there is one interphalangeal joint because there are 2 phalanges only. So interphalangeal joint, metacarpophalangeal joint, carpometacarpal joint, intercarpal joint, then intermetacarpal joints, and the wrist joints, and also the inferior radioulnar joint. So there are so many joints are there. So that's all for the X-ray of the wrist and hand. Thank you very much.